Greetings to everyone in Pakistan in this wonderful Congress which you have organized, the SOGP. I've been asked to talk to you on violence against doctors, an emerging epidemic amongst the COVID-19 pandemic. In India, I'll be concentrating, but it is world over. It's a world over. See, look at this video in the news which has come after this person died. Look how all the attendants barged into the ward and started beating up the doctors and the healthcare professions. So this should never be happening in this. And then another news item here, which we can see that violence against doctors in COVID times is there, and how to do it, how to prevent it, why it happens, when it happens. I thank my co-authors, Dr. Narendra and Reena Wani, who shared the violence against doctors presentation and the COVID presentation Dr. Jaideep added for us. So we did in these times run into a lot of emergencies and even bigger hospitals where we took care. So we selflessly took care of patients, did not go home, did not eat feed, beat all the odds, did 14, 16, 20 hours duties together, did not see see our family for days because we were isolated there. We might carry the infection outside. And this still, when you look at the BBC published report on 3rd of April 2020, actual severe pandemic hit India in the mid-April, but even early, Indian doctors were spat at, they were spitting, they were throwing stones. They threw the junior doctors out of their houses where they were living. The shopkeepers did not give them. And that's when our Prime Minister addressed the nation and told that, and the parliament, that doctors have to be looked after. Lakhs and lakhs of doctors were looked after, and they were declared as health warriors. The doctors, the paramedical staff public were asked work like soldiers, and that is where we were praised by the public, by some of the public, and other things happened. So COVID changed the whole scenario. The scenario was quite bad in the developing countries and is still quite bad in the developing countries as violence against doctors because of a lot of reasons. We'll just come to those. But in COVID, it was like fire. So the situation in the world, the COVID spread all over. People were dying all over the world. And today we have the Omicron and we have the Delta Coron and we have newer variants which might just come in and still be equally bad like the April 2020 outbreak. Hong Kong still is facing a complete lockdown and a very severe wave. The rest of the world, the cases are reducing and things are improving, but new variants would come, so we need to be prepared. Now, look at what Robert Owen said long back. He said, God and doctors are alike adored, but only when the patient is in danger, not before. And once the danger is over, both are acquitted. God is forgotten and the doctor is slighted. So that is what is the reality about God and doctors. And that led to violence against doctors, and that led to all the junior doctors in India come down to the roads with placards, Doctor ke achhe din, do not harm your lifesavers. We are a nation, respect your soldiers. Now, these are some of the statistics before the COVID times, which were done in webinars very soon. And a study by the Indian Medical Association in 2018-19 showed, before the COVID, that 80% of the doctors in India were stressed in their profession. Fear of violence, fear of being sued, fear of the patients for violence, and they were hiring severe security in their premises. So that was what is happening. And then the violence against doctors cannot be tolerated. Lots and lots of newspaper articles, editorials, all that came out, and all the things, everyone worked on it. A lot of cartoons came out in the magazines and in the papers. You see many newses, doctors assaulted and beaten up in Ahmedabad hospital, junior doctors beaten up at JJ hospital, but then those who beat them up got arrested. Baby dies and the family beats up the doctor. Sion Hospital, third attack in 1 week. These things kept on happening in the public sector hospitals and more also in the private sector hospital. Then in 2003, we saw a SARS outbreak. So worse disease, could not be treated. And it was attacking all the systems. And again, people were dying. And then the violence increased. Then, of course, came COVID-19. 2019 November, the first COVID case, and India faced a crisis. The world faced a crisis, and all the leaders came out against this, and there were bodies all over, the people dying, and we did not know what the cure was. We did not know how to do it, and that led to an increase in violence against doctors, an increase in crowds, public outrage against the medical facilities. So when we look at what happened was, COVID-19 was an explosive fuel raising the fire. And this fire got activated because of people dying. So despite of many reactionary measures, enhanced security to the doctors, workplace, medical negligence laws, Indian doctors teetering the pandemic, detrimental growth, all that, the society just reacted very badly, and the media fueled this. So the pandemic, the COVID, became probably the #1 cause of death. And that led to strict social distancing measures, and the doctors got scared. So what we need, the challenge we faced was that patient concern. We need to save the patient, whatever. Practice management, how to manage our practice with the non-COVID and COVID patients and segregate them, and medical staff getting infected and medical staff being cared for. So that was the biggest challenge. And then staying for hours and hours and days in this uniform, sweating inside and not even being able to change, taking the disease back home. That was. So it was a fiery recipe for disaster. And who was blamed? The healthcare worker. So that led to such a outcry that in the last 2 years, so many doctors had refused to send their children, these lovely girls who are giving the exam for entrance exam, to make them doctors. And a majority of doctors are now unwilling to motivate just because of this. Every day there was a breaking news of attack, local doctors attack. These 2 girls just went for a survey into a colony and they were beaten up. And this video was the most viral video in India of these 2 girls. See how they were pelted by stones. And, you know, it was not only COVID. That time, India was having a law, or what we call as for citizen amendment law. And that a lot of people had a bad negative value of that law. So was spreading negative rumors about that law, and the pandemic came. So that probably that also made the whole things worse. So doctors being beaten up, doctors being not able to go and do surveys or do treatments. And this video went very viral. So, but the BBC, task force, Dr. Ananda, Government of India, nothing, even the CA law, controversial citizenship law, anything can justify the attack against a medical team. This did happen, and the anger did spill. So this was condemned. Then the Government of India took some steps. They gave Corona Warriors Awards. They put petals over the hospitals from helicopters on the hospitals which are dealing with COVID patients, and they flowered all of us. And so government agencies did work in tandem with the public and tried to boost up the image of the medical. And our Prime Minister himself in his speech in the Parliament said, these are the health warriors and these need to be respected. So these cases could have been handled better or not better. How we could have prevented such an attack of a doctor lying like a patient all beaten up is going to be a debate. The private sector was equally affected, especially those private hospitals were allowed to do COVID duties. Small private hospitals were all closed down in the first wave. In the second wave, we all did work in the not COVID. What caused this image is some poor image, which is highlighted by the media, because the health budget is poor. So the public hospital care is not as they want as a 5-star. There is a small and medium hospitals which were at risk. The faith in the judicial process is not there. The cases take a long time. The mob mentality, one of them puts a fire and the whole mob reacts. Health literacy is low. Nobody saves money for health. Whenever a worker you ask, they save money for a daughter's wedding, son's wedding, make a house, everyday food, but there is no health budget because everyone feels that they will not get sick and nobody takes insurance. Lack of security, lack of insurance, poor communication, all that led to all this. In our specialty, OBGYN, pregnancy was a stress, infertility was a stress, ART services stopped, pregnant patients were dying. So that put additional stress, young, pregnant, COVID affected patients, and more violence erupted. So what we did was we put a counselor. So we put extra counselor and we did a teleconsultation with all pregnant women who were registered with us and to their families. And we ourselves would visit them in the hospital, in the ICU, cheering them up. I will tell you that there were times because we got COVID in first week of April. So I was immune and Jerry was immune. So we both used to visit the ICU every day, take some sweets for the people who are recovering, who are suffering. We would go as Santa Claus. We would go dressed up as gods and try to boost up. So that image of, so you have to have a tender loving care also. So that, and of course, charges do not overcharge. The government had put a cap in India on treatment caps, and that was followed. There were a lot of myths circulated when the vaccine came. And so vaccine hesitancy increased. And that was another challenge for us. So whenever we would go to vaccinate, again get beaten up because people would say it'll make you impotent, it'll make you infertile, and all that bullshit. But we got all our staff vaccinated, all our healthcare persons vaccinated. It's very, very essential. So we could proudly say this hospital staff is fully vaccinated. And that's a badge which my staff carries on the chest very proudly. Well, the first medical law was done in the state of Maharashtra before the COVID times. And this said that if a medical service person is abused or violence is against him, then they will go to the first class judicial magistrate and the punishment would be done to them. If the offender has to be punished, and that is a state government official gadget. During the COVID, the national central law came in for prevention of violence. We were all fighting for the national law, and it became a cognizable offense with stringent punishment. So what should we as doctors do? Do not overreach. Do not take proper consents, proper documentation, proper communication. Be very alert. Restrict the entry of attendants. Standard operating procedure, follow that and take an insurance. And then we have to pressurize our governments, all of us, to make it a criminal offense to attack a doctor. Just like to attack Indian administrative service or a civil service officer is a criminal offense, same has to be made for the doctor. That's what it is. And then we made manuals and we circulated to the police so that the police is well aware of what the latest law is and what are the doctor's problems are. 2018, under the presidency of Dr. Jaideep Malhotra and our federation, the Federation of OBGYN Societies of India, 34,000 members, 256 cities, made a violence against doctors cell. And in this cell, we appointed a doctor in all the branches where anyone who is attacked would address their problem in this algorithm. And the problem will be sent to the police, to the lawyer, to the central office. And proper action or help will be given to that doctor so immediately when a mob attacks, all the doctors of that city gather there and fight that mob or try to explain and then call the police, call the lawyer and do a proper legal. So this is how we are tackling violence against doctors, non-COVID, and during COVID times, this has become active. So ladies and gentlemen, we have to stop violence against doctors. That is what we have to do, build up our image, build up our truthfulness, build up our honesty, and build up our not overcharging and trying to. So to conclude, COVID will stay with us. If COVID doesn't stay with us, some other new disease will come, which will be maybe even worse. So pandemics are going to come because we have The human mankind has tempered with the environment so much that we're going to get newer and newer diseases. But of course, we will find cures and vaccines for all of them. So good practice guideline following at all possible levels, awareness program for people, insurance for healthcare workers, for hospitals, for hospitalization. The world is not going to be the same place ever to live at. So let's live it with all the precautions. And we thank the government of India and the Prime Minister of India for flowering us or recognizing healthcare workers as healthcare warriors. And this is what they did to us, which boosted us to fight this pandemic. We are going to win. We will end this pandemic very soon, and we will be ready to face any future pandemics which might be coming. Thank you for inviting me here. I'm there for any questions which you might have live, or you might address to the chairperson right now and can be sent to me. So thank you all our friends in Pakistan, the Society of OBGYN in Pakistan, SOGP. Congratulations for organizing this conference, and thank you very much for inviting me here to be a part of it, to share some of my views on violence against doctors, especially in COVID times. Thank you.